Joining us now is the governor of Delaware, Democrat John Carney, who yesterday issued several executive orders pertaining to the spread of coronavirus in his state, including the closure of all non-essential businesses and postponement of the state's presidential primary. Governor, thank you very much for joining us. What are the numbers saying about your state, where it's headed in terms of this virus? And do you foresee being able to reopen everything magically at Easter time?
Well, first of all, a big thank you to my former colleagues in the House and the Senate for getting together to pass that legislation last night. And also a big thank you for all the healthcare workers here in Delaware and across the country for what they're doing. The situation on the ground here in Delaware is getting worse. We're seeing more cases. Our hospitalization rate is not as great as it is in some of the other states, and that's a good thing. And so the focus really is to follow the advice of the scientists, the doctors, Dr. Fauci and others, and that is to flatten the curve. So to reduce the spread of the virus here on the front end, really to protect hospital resources on the back end. And part of that, maybe the most important part of that, is protecting our senior citizens, the most vulnerable population, and the ones most likely to be hospitalized, to need those services and the ventilators that are in short supply. So our focus is on two things: making sure we have those resources, freeing up hospital beds, being prepared to stand up a mobile hospital if need be, and then on the front side, really pushing out the message to stay at home, shelter in place, if only go outside, to go to a permitted open business, to go to the grocery store, to assist a parent or family member. So really the message is stay at home, shelter in place, and then we're working on the back end furiously to make sure that we have the hospital resources that we might need.
And so how do you do that? Obviously, talking to Senator Schumer, who has grave concerns, as I think most healthcare officials do, about the shortages that doctors and nurses are already seeing in New York City. How do you make sure that your state is prepared as humanly possible so you don't face the same shortages?
Right. So we think about all the different pieces of the puzzle and the limitations that we have there. So it's beds, and then it's ICU beds, and then it's ventilators to support those beds. But those beds are worthless unless you have the healthcare workers, the respiratory therapists to monitor the vents, and the nurses and the physicians. And so you have to have the protective gear, the masks and the shields and the gowns to protect those healthcare employees. And something that most people don't think about, you also have daycare facilities to stay open or stand up ones on your own in order so that those parents, those healthcare workers, have a place for their children to go. Otherwise, they're not going to show up at work. So we're working on all those pieces and trying to figure out what is that most limiting factor. And right now, it looks like as those issues around making it possible for healthcare workers to go to work, to go to the hospitals. And again, my hat goes off to all of them for the great work that they're doing.
Yeah. We are most concerned about healthcare workers getting infected and creating a cycle. There's also asymptomatic carriers, which is so concerning because you're flying blind with no testing. What about in your state trying to separate the sick from the coronavirus sick?
Yeah, that's a really big issue, and it goes back to the very beginning, right? We haven't been testing nearly enough people from the start, so we never really know where we are. And because of the way the number of days it takes before you see symptoms, and you have symptoms, you can be walking around and you don't know that you have the virus. And by the way, the tests don't really work until you are symptomatic. So going out and testing everybody doesn't make a lot of sense, is what the scientists tell us. So we're trying to be driven by the science, test as many people as we can. People are asymptomatic. We've stood up a testing program in each of our counties up and down our state. It's a little easier to do in a small state like Delaware. We don't quite have enough tests that we need, but that is ramping up as well. So the bottom line is, though, we don't know exactly where we are on a day-to-day basis. We're always a couple of days behind. And so we have to act and plan as if the situation is worse than the numbers tell us on a given day. We do know the hospitalization numbers because, obviously people are there and turning up in the emergency room. So that's a good indicator of where we are in terms of hospitalization rates vis-a-vis those who are testing positive.
All right. Governor John Carney, thank you very, very much. All right. The coverage continues all day here on MSNBC as this crisis unfolds. That does it for us this morning. We'll be back with more live coverage after a short break.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.